Welcome and thanks for joining us. My guests today are John Smith, an IBM Fellow with the Discovery Technology Foundation's Accelerated Discovery at IBM Research, and Amit Erdemir, the Chief Scientist for the Cleveland Clinic IBM Discovery Accelerator. Amit, John, thanks for joining me.
Good morning.
Thank you for having us.
And Amit, I'm going to start with you just to unpack a little bit more about what the IBM Discovery Accelerator is. Tell me a little bit about it, how it brings together quantum, AI, the cloud, and ultimately what the healthcare research and patient care goals are here.
Of course. And as you know, like in biomedical research and health research, we really need to move fast. And we learned that lesson in the pandemic really well. And we need to discover quickly, and we need to actually translate our discoveries and put it in the hands of our caregivers and also to the public really quickly. Unfortunately, discovery doesn't happen that quick in biomedical research. It takes maybe a decades from an idea to some tangible products to put into the people's hands. And thus, we really feel the needs to how we can accelerate our discovery, but more importantly, how we can disrupt discoveries, maybe to think about how we can actually discover areas do some innovations that we may not have thought of. And thus the Cleveland Clinic IBM Discovery Accelerator was born. And this is really about the intersecting cutting-edge biomedical research, the constraints and the desire to deliver health equitably and quickly, and how we can actually intersect that with advancements in computing technologies and computer science.
All right, thanks for that, Amit. And John, over to you. How did this partnership come together between Cleveland Clinic and IBM? And what does this really mean for this intersection of all things quantum, AI, and cloud?
Yeah, sure. So, as Amit has said, with all the pressing challenges the world is facing related to health, but even more broadly, climate and sustainability and food and water, we need science more than ever. And science, and in particular, the scientific method, is the best tool we have to develop solutions to complex problems. However, given all of our challenges, we need to greatly increase the pace of scientific discovery. We need to be even more efficient and effective at exploiting data and knowledge and computation in clever ways. In short, we need to overcome the bottlenecks in discovery. And that's where AI, a hybrid cloud, and quantum computing come in. AI, for example, allows us to create new knowledge, to make more accurate predictions about things, reduce the cost of expensive simulations, and even generate new ideas and hypotheses. Hybrid cloud gives us a way to glue together all of the disparate resources we have when we do science. These can be supercomputers, they can be public clouds, other kinds of hardware accelerators, or even scientific devices. And quantum computing ultimately promises to be the biggest game changer yet for scientific discovery by giving exponential speedups for certain kinds of computation. So it's really, in practice and ultimately, these computing technologies can allow us to go faster and reduce the cost and create new and urgently needed solutions to problems like those being investigated by the biomedical researchers at the Cleveland Clinic.
Okay, great. And this Discovery Accelerator has a number of projects that are doing just this, leveraging the latest and greatest in quantum and AI. John, we'll stay with you. Can you walk us through some of the specific projects that you're most excited about?
Yeah, sure. I'll give a few examples here and let Amit describe some as well. If we look, for example, at the space of de novo design of drugs, or it could be new therapeutics or biologics, it can take up to $1 billion or even 10 years of research and development. And this is due in part from the enormous search spaces for solutions. So, for example, it is estimated that there are 10 to the 63 possible drug-like molecules. So each new drug is like finding a golden needle in an enormous haystack. So we're investigating how to use quantum computing in this space for drug discovery as well as AI. I'll talk about one of the AI projects we have here, which is around 3D, 4D molecular representations. So the idea is to try to learn from the vast amounts of data in the chemistry and biology spaces and produce 3D and 4D models that can help us predict properties of these molecules within biological systems and even generate entirely new molecules with desired properties. Additionally, we're investigating some projects related to quantum computing and drug discovery, and I'll let Amit describe those in some more detail.
Oh, certainly, John. And I think protein structure prediction, for example, an area, a very hot area, as a matter of fact, because it's a very foundational area for drug discovery and for life sciences, as a matter of fact. And quantum computing, naturally, the way computing is done, in quantum systems, is naturally fits into simulating protein structure predictions, and where sometimes when AI may actually have some limitations, where we can actually leverage and get quantum computing advantage, to be able to predict protein structures. And that also applies to enhancing molecular simulations, through the use of quantum chemistry. And again, and we are not actually limited in our projects, in only quantum as well, because I'm very excited about our process, in our projects, because we really have a pipeline where we are, bringing investigators together. We are identifying our data challenges. We have voluminous data, but it's sparse, it's heterogeneous, and dependable and timely predictions are critical. And all AI, high performance computing, quantum computing, all really fits into capture this whole ecosystem that we can operate. Another project that I am rather excited about is the utilization of deep search, for our clinicians, as well as physicians, scientists, and our scientists, to really identify areas maybe that they need to focus on in terms of working, but also really capturing what do we know as in the world on so that they can actually help them to make correct decisions and timely decisions, or even identify discrepancies that is currently available in scientific literature.
Okay, well, this is a lot of change management for any industry to manage here. John, can you speak to efforts that the Discovery Accelerator is taking on to educate the future workforce on this type of cutting edge quantum and AI technology?
Yeah, education is a big focus of the Cleveland Clinic IBM Discovery Accelerator partnership. An important objective is to create and educate the workforce at this intersection of science and technologies like AI and hybrid cloud and quantum computing, and ultimately create jobs and grow the economy. Our Discovery Accelerator has developed a curriculum. It spans from high school to the professional level, including medical students, including research trainees. It offers training and certification programs in data science, machine learning, and quantum computing. And together, the Cleveland Clinic and IBM are also creating research symposia and workshops, including academia and industry and government and the general public. And this includes hosting the first quantum computing for healthcare and life science working group meeting, which we did this past spring.
Okay, great. Well, in terms of Amit, this next steps for the Cleveland Clinic efforts being there with IBM and the Discovery Accelerator, what's kind of next here? What are some significant things to look forward to here?
Yeah, and I will actually first tag along a little bit on the education side, because there is the important aspect of workforce education. And one of my highlights is my weekly meetings with John, because in each of our meetings we first educate each other, and we are changing cultures in our respective institutions from that perspective. And we are getting those in institutions from biomedical side and from computing side closer to each other. But of course, really, we are right now doing it together, but we are thinking beyond us too, because we are really hoping that we will be bringing partners from a lot of regional partners, and we already incorporated trying to having communications with our regional universities, for education, but also for discovery and for innovation. So we are not actually limiting it, to only us, because we are there like to really, build a community and build a, ecosystem like with all the connected partners.
Okay, well, just looking forward here, Amit, in terms of what's on the horizon, I know IBM Quantum System 1 is kind of the latest and greatest at what's over at the Cleveland Clinic. So just tell me why that's such a watershed moment for your partnership and how this is going to aid everything that we've been talking about in terms of breakthroughs in the healthcare space.
Yeah, certainly. I mean, of course, this is the first IBM quantum computer installed in a private facility in a sense, and then it is the first in the biomedical health research in a biomedical health research institution, and and really it gives us the advantage to have, in a way, like within our research system, an exclusivity. We can access it. We can actually run a lot of exploratory but also like intentional like quantum computing like projects there. But more important, there's an inspirational component. If you are there, like if you are sitting next to the quantum computer, which is essentially in the middle of our cafeteria in our research institutes, like, with a computer scientist, you are as a biomedical researcher, as a clinician, like discussing a project next to it and immediately being able to like start executing like, simulations is very inspirational. And I think it opens up like a lot of opportunities for us and for the world, as a matter of fact.
All right, and John, over to you. Is just as far as what's over the horizon here, as far as kind of, Amit kind of teed up what's the latest for this IBM Quantum System 1. What's over the horizon?
Yeah, so very exciting point in time here because the capabilities being created together in the Cleveland Clinic IBM partnership are truly unique, and they promise to be truly transformative for accelerating biomedical research and impacts for healthcare and life sciences. Already dozens of collaborative projects have been launched. We invite interested parties to get involved in our projects or even bring new ideas for projects. We welcome others to join us in this journey. And listeners can visit our website or feel free to reach out to me, John R. Smith, or Amit Erdemir to follow up or learn more.
Well, I think we're going to have to leave it there. I'd like to thank today's guest, John Smith, an IBM Fellow with the Discovery Technology Foundation's Accelerated Discovery at IBM Research, and Amit Erdemir, the Chief Scientist for the Cleveland Clinic IBM Discovery Accelerator. I'm your moderator, Jory Heckman, and you're watching Federal News Network. Now let me send you back to the studio for more on the Cloud Exchange.